And there we go. Well, hi, everybody. It's Dr. Steve here, and we are in our redefining movement class for today. And what we're going to do is we're going to keep working on building your back. We're moving beyond back pain. We started a couple of weeks ago where we were building your foundational mobility. We're going to review that a little bit today, but then we're going to just keep expanding and building into some higher level stuff and doing some more and more fun things. So let's keep going with our melt, mold, move kind of sequence. And so what we're going to do is get started with getting things melting a little bit. We're going to wiggle stuff. We're going to use some of the foundational mobility exercises that we've done back in the beginning to serve as our warm up. So here we are. We're going to start onto our back. And let's go with the feet a little bit wide, so at least hip width apart. And then we're going to start with the rocking the knees back and forth. Oh. So we're rocking the knees back and forth. And here we're really working on our foundational mobility, is what I like to call this. And these are some of the initial moves that you can do, and they're your go-to exercises if you have a back tweak or a flare up or something gets kind of wonky in there and you have an episode. Going to these initial foundational mobility exercises are going to be your good go-to tools. So now let's bring the feet a little closer together and do some of the rocking back and forth. So if you've been following me, you have an idea that when we have the feet a little wider apart, we get more motion into our hips. When we have the feet more together like this, more narrow, then we get more motion into the spine because the pelvis is moving a little bit more. So we're just getting some rocking going. We're getting the juices flowing. We're lubricating things. A couple more here. And then we're going to go into some pelvic tilts. So pelvic tilts being where you can rock your pelvis back so that you're flattening your low back to the ground, to the floor, and then you let it arch a little bit and flatten back. This is not doing a bridge yet, where we're going to get to doing a bridge in a little bit, but not just yet. First, we're just starting with some of these pelvic tilts. And again, this is, you can think of it as a fluid pumping kind of exercise. We're just turning things on. We're establishing some of that mobility in the lumbar spine, that lumbo-pelvic connection, where your lumbar spine is connected to your pelvis. So we're getting things moving there, and we're just doing some of these pelvic tilts to lubricate things. And then we're going to go into the tail wags. So this camera angle might be a little bit hard to see. This might be a little bit better, but what we're doing is we're wagging the tail from side to side. And again, these foundational mobility exercises, we're asking the pelvis to move in 3 planes of motion, and we're positioning the body initially where things are feeling the most safe, the most secure, which is lying down on your back. You're not going to fall anywhere or tweak anything. So you're just gently moving the pelvis side to side in this little side bending or tail wagging kind of motion. We're rocking back and forth here. Okay, so getting our foundational mobility going, getting the juices flowing just a little bit, starting to turn things on. I'm going to change my angle again so that you can see me a little better. So now we're going to start to really get things warming up a little bit more. We're going to melt stuff. We are going to go into the bridges. So what I want to have you do is rock into the pelvic tilt and lift up into the bridge. And you're lifting up kind of vertebrae by vertebrae, spine bone by spine bone as you're lifting up into a nice high bridge here, trying to get the pelvis so that your thighs are in line with your trunk. I'm going to do 3 more here. And then we're going into the side to side. So here, trying to keep the pelvis level, and we're doing the hips side to side. So if you were with me last week, then you might recall that we did this one as part of the sequence that we did. We're doing it again this week. We're reinforcing this, but then we're going to build on this. So this is where we were doing the pelvis, moving it around in the 3 directions. First laying down flat onto your back. Now we're elevating into a bridge. So we just did the first up and down, then you did the side to side. Now comes the rotation. So we're going to lift the hips up, and then you're going to twist the pelvis back and forth. And what we're doing is we're controlling the pelvis moving in space, and we're going to keep positioning the body in different positions. And we're going to be doing things that we've done all along, but we're going to just ramp it up a little bit and put it into this little routine for today. So we're going to be controlling the pelvis moving, and that's good for being into the bridge. So now we're going to do more pelvis motion control into the side plank. So from here, we're going to do the knees rocking back and forth, and then we're going to roll right into the side plank onto your side. But we're going to lift the pelvis. We're going to go up and down here for about 5, and then we're going to go forward and back. And then you're going to twist, rotating down and up. So we're trying to rotate the pelvis and the trunk on that stationary leg. One more, that might have been 6. Okay, then we lower back down. We're going to rock a couple of times, and then we're going to roll right into the side plank on the other side. And we're going to go up and down. And then we're going to go forward and back. And then we're going to rotate. Good. Lower back down. We're going to do at least another one each side. So a few times rocking the knees. Arms are out to your side, bent at 90 degrees. And that's going to position your forearm into the right spot for rolling right up onto that arm. So then we're going up and down, forward and back. And here we're positioning the body into this side plank position. And then we're rotating and we're controlling the pelvis, trying to move around in space. Good. Lower back down. Rock a couple of times. Have the arms into the right position and roll up into your side plank on this side. And then we're going to rotate. Good. Okay. So now we're going to do the same kind of thing, but we're going to roll all the way over into a front plank position. So we are on our backs, lifted the pelvis up, moved in 3D space. Then we rolled to our side, we lifted the pelvis up, then we were moving around in 3D space. Now we're going to roll all the way over into a front plank, but we're going to do it from a bridge. So what that's going to look like is you're going to lift up into a bridge, one leg straightens out, and then we're just going to roll on the shoulder, and on that heel, we're going to pivot all the way over to front plank position. Now you're here, and we're going to take the hips and make it a dynamic front plank, going up and down for 5, and then keeping level, and we're trying to move side to side and control where the pelvis is moving in space. And then we're going to twist. So again, now we're in a new position, in a prone position, planking, and we're asking the pelvis to move around in space. So then when it comes to going back, I'm still on my toes, but I drop down to my shoulder, and then the one foot steps over, and we keep the hips lifted up the whole time, and then we go to the other side. And so here we're in our prone plank, and we're going side to side. And then the twist. I go down to my shoulder, foot steps over, rolling back to the bridge. Gonna reset. Let's do another one each side. So we're lifting up into the bridge. We're straightening out one leg. The heel is down, rolling over the shoulders into front plank. Make it dynamic here. A little side to side. And the twist. Okay, and we're going to reverse that back here. We've got one more on the other side here. Remember, we're controlling our motion. Here we are controlling the pelvis, moving in space, hitting the different directions. The more that you can control your motion and your pelvis as we position the body in different positions, the better. Okay. So that was pretty good. That was getting the pelvis going in 3D, and we kept changing positions on your back, on your side, on your stomach. So that's going to be a good warm up for everything. Okay, next we're going to do some of the side sitting hip rolls. Let me see if I can kind of position myself so that what we're going to do with these today is get a couple of rolls going back and forth first to get things warmed up. As you can tell, I use my hands at first, and then we're going to progress to no hands. Get things going. Rocking on the butt from side to side, trying to get the legs down as best you can. If you can't get knees all the way down, that's okay. And remember, using your hands is okay. But where we're going from here to that split kneel, I want to have you stand all the way up, and then we're going to reverse that back down. So the leg will come back down. This front knee will come back to the level of that other foot. That puts us into that split kneel position where you can sit back down, rock the knees over to the other side, up to the knees, all the way up to standing, and then the leg that just came up reverses that back down, knee to the level of the foot, easing back down, rocking over to the knees, all the way up, reverse down. We'll do one more to this other side. And now I want to progress one more layer onto this. So we're going to go all the way from lying down on your back to standing up using that side sit position leading into the split kneel, but we're going to do it from what I like to call an alarm clock reach. So that's where we're going to start onto your back. One hand is going to reach across so that your shoulders are coming up, but your knees are staying still. So maybe what I'll do is spin around so that you can see what's happening with the shoulders a little bit easier. But here, reaching up and across. So the shoulder blade is coming up, but the legs are staying still at the moment. So we're going to get just a couple of reaching for the alarm clock. It's going off. You're trying to hit the snooze. So you're reaching across. Okay, so now what's going to happen is the reach is going to come down, and we've worked on these a little bit, but the reach is going to come down. You're going to come up to your elbow and then back down, up to the elbow on this side and back down. So as you lower down, you're kind of rolling from the back of the arm across the shoulder blade to the other arm, up to the elbow. And then we layer on the split kneel, coming to the other side, going all the way up to the split kneel. And then we're going to take that up all the way to the standing. So starting with the reach to the split kneel, up to the knees, all the way up. And then we're going to reverse that back down. Remember that front knee comes back to the level of the foot. From there, we lower back down, coming down to the arm, and then you're in your original position. You're going to reach for the other side into the side sit, coming up to the split kneel, all the way up to standing, and then back down. So we'll do at least another one each side, nice and smooth. We'll do one more each side. And we'll stand and stay all the way up from there. Okay, did some melting, some molding, some moving, some stuff moving around there. That was good. So now we're going to get moving a little bit more with some standing reaches. Now, last time we did some standing reaches where we had both feet onto the ground and one foot was forward and we were reaching in a bunch of different directions. The reaches are going to be the same, but this time we're going to progress this to where you're balancing on the one leg and the other toes are just kind of keeping you there for a little bit of balance, a little bit of support. So all your weight is on the one leg. The knee is just slightly bent, so you're just not locked, because what we want to do is one hand reaches out down low in front, coming up and back. Other hand, down low in front to up and back. And we'll do a few for each side. So you're reaching down low in front of you, stretching up and back overhead, down low in front, up, back overhead. Let's do one more each arm. And again, all the weight is on the one side. The other toes are just keeping you from falling over. So we're going to keep the legs the same now. The hand is doing the reach across the body, down low, kind of opposite side lateral, to up overhead high, same side lateral. So opposite side lateral, same side lateral, down and up, up, and up. Good. Let's do a couple more. Okay, so now staying on that same leg, we're going to do the rotation ones. So this one is where down around the corner behind us to up overhead behind us, down around a corner to up overhead. So all your weight is on the one leg. The other toes are just keeping you from falling over. And as we put all the weight on the one side, it has to do all the tough work. Let's do one more each side, down low around the corner, up overhead, down low around the corner, to up overhead. Wonderful. Here we go. Other side. We're going to be balancing with all of our weight on the one leg, the other toes just keeping us from falling over. One hand reaching down low in front, up high overhead behind. And we're doing a little bit of a reach each direction. I call these 6D reaches because we're going to 3 planes of motion, but 2 directions. We're going forward and back, forward and back, one more each. And we're doing both ends of each of the 3 planes of motion. So that brings us to 6D reaches. Weight is still on the one leg, the other toes are just keeping you from falling over, reaching down and across, up and out to the side. So here we go, reaching opposite side lateral low, same side lateral high, opposite side lateral low, same side lateral high, going back and forth, making a big crisscross kind of pattern with the hands, doing these big diagonals. One more each side. Okay, good. Final one of these reaches, these dynamic reaches. Now we're going around the corner, opposite side lateral low to same side lateral or rotation overhead. Get my words mixed up. Opposite side rotation, same side rotation. So going around the corner low to back around the corner high, around the corner low to back around high. Couple more each. Okay, beauty. Okay, so we did a bunch of reaching. Now let's finish it up with just a little bit of lunging. And what we're gonna do is the one foot is gonna be stationary, the other foot's gonna be hitting the 3 directions, but we're gonna have our hands going towards that lunging foot as we're going forward and away as we're going backwards. So hands are rotating around the corner as the foot is stepping forward and back without stopping in the middle. And remember, one of the repeating themes that we talk about is controlling your motion. Motion is lotion. We get things lubricated, but I want you controlling your motion. Let's go one more. That's such a big key to injury prevention and to getting over back pain and back pain issues is controlling your motion. And so here we're going to do other side. Foot is lunging forward. Hands rotate towards that side. As the foot lunges backwards, hands rotate away. Let's do one more. Okay. Now the lunges are going in the frontal plane, side to side. We're going to keep the hands going in the rotation. So this time you're going to step, lunge out to the side, toes are pointed forward, hands rotate away. And then as the foot lunges across the body, opposite side lateral, the hands are going to rotate kind of opposite the foot. So we get a nice big twist and rotation. And remember, what we're after is controlling your motion as best you can. The more that you can have control over your body and dictate what's going on, the better. One more. Okay, out to the side and across. For this one, toes are pointed forward as you're lunging out to the side and then across the body. We want to keep the toes pointed forward the whole time for this frontal plane. One more. Okay. Now we just have the rotation step left. And so for this one, we're doing the lunge out and back, turning the toes out, and then lunging across in front, turning the toes across. But what we're going to do is I want to have your hands going opposite. So it's going to be stepping out and back, hands go away, stepping across in front, and hands rotate across. And as we get multiple parts moving in different directions at the same time, we want to make extra sure that you're controlling your motion and just staying within the zone that you feel like you can complete it, not have pain, and not fall over. Let's go two more. Okay. And then we have the other side to bring it on home. And sometimes it gets a little confusing to get everything started at once. So start with the foot in one position, and then start with the hands in the other position, and then you just kind of unwind. So this one is where when you step across the body, you really do want to have the toes pointed across the body. And this is where we're doing, it's called opposite side rotation with the foot, and then same side rotation. But we're looking to rotate the lunging foot across the body, open up out and back, but not the stationary foot. Two more. Okay. Well, there we did it. We molded, we moved, we melted. We did that in the melt, mold, move sequence. Got everything going. We started with some of the foundational mobility, moving the pelvis in different directions, laying on the ground. And then we took it into some dynamic plank kind of movements, doing front planks, side planks, and bridges on your back, controlling the pelvis moving. And then we worked on getting up from the ground and getting up from laying down. And then we went into some stability, dynamic reaches, and some lunging, controlling your motion as parts are moving all over the place. So that's an example of some of the stuff that we will do more and more into the future, and in our upcoming back course that's going to be released in 2021. So be on the lookout. It's going to be a pretty incredible program that will help you find the relief from pain that you're looking for and the freedom in your body to do whatever it is that you love to do and express your joy. So until next time, take care, everybody. Keep moving.